Well, for more discussions on the World AIDS Day, we're now joined by Dr. Ashefor Gregory, Director and Head of Department of Research Monitoring and Evaluation at the National Agency for the Control of AIDS, NACA. Glad to have you join us, Ashefor.
Thank you very much.
Looks like there are so many hindrances on reaching this goal of 2030, but we will get there. Let's tackle this question. I see that's what you're wearing on your body. End inequality and AIDS through sustainable financing. Let's tackle the question of inequalities driving AIDS and other pandemics around the world. How to go about getting a hang on it?
Thank you very much. I think it's a major issue, and that is why this year theme is on end inequalities and AIDS. And Nigeria has a sub-theme, end inequality and AIDS through sustainable financing.
Okay.
We've discovered that there are so many gaps in reaching this goal in 2030. 2030 goal is zero discrimination, zero death from AIDS-related death, and zero new infection. In getting this, we discovered that there are some people that have not been reached.
Yeah, like these are the
These are the mothers, pregnant mothers who have HIV/AIDS, who are not accessing treatment. These are children born with HIV/AIDS from the pregnant women. In Nigeria, the government has made it very clear that it's not acceptable for any child to be born with HIV/AIDS. There are some people too who don't have access to these drugs. These are people who are most at risk, who like men who have sex with men, people with jet drugs, and female sex workers. The research study showed that about 25% of these people, men who have sex with men, and 70% of female sex workers, and 10% of people with jet drugs have HIV/AIDS. This is very alarming, and we believe that everybody should have access to treatment.
Everybody should have,
yes,
because
irrespective of your lifestyle.
Yeah, irrespective, because then they will affect other people, and then there will be trouble in the society. You talked about children, and that bothers me a great deal. You know, in Nigeria, 30% of AIDS-related deaths in 2020 occurred in children. That's high. How do we change that narrative and the indices?
Yeah, I think the challenge is that we just have to get this pregnant woman. That's the first point of call. The first entry point is testing. How do we get them tested, pregnant tested, and how do we get them into facilities to deliver? Those, if you see approximately about 1.8 people are living with HIV in Nigeria, out of which about 60% of them are women.
60%?
Oh yeah, are women, yeah. And again, if you look at the estimated number of pregnant women who are pregnant, who are in the country, it is estimated about 83,000 people have HIV/AIDS in the year 2020 alone. And the program was able to cover only 44%, which is
any reason for that variable?
Yeah,
60% of women.
Exactly. Yeah, and the reason is that one, the anatomy, the female anatomy also gives that room for that. And secondly, the women don't actually have access to this treatment. Most of them in the communities. If you look at those, presently we are treating about 1.6 million people with these drugs. They're on these drugs, and about 1 million people are women. But we still have some left. These are the colleagues we're talking about. These women will not ordinarily go to the facilities. These are women who are delivered in churches, that are delivered in the community.
Now they say if the mountain doesn't go to Muhammad will go to the mountain. If the women can't come out, how do you...
That is the new strategy we are adopting now. We are adopting a strategy where we now take these services to the community. Because we believe that the community ordinarily will not go to facilities, they're the community. So the new strategy is to take these services to the community, to meet them at the community and get them. Now we're using field-based organizations, we're using some peer mentor models, we're also using the community itself to assess them. So that will make a big difference.
Yes. All right. I mean, how much, I think they raised the issue there, and I have it here as well. How much harm is the fear of stigma doing to the use of preventive drugs?
Yeah, we just conducted a study called the Stigma Index. We still require the Stigma Index is still very high in the country. Most people are stigmatized, and that actually limited accessing these drugs. And the only way to do is through mobilizations, sensitization, and using peer groups and support groups to break down this level of stigma among these pregnant women. So stigma and discrimination is still a very big issue. It's one of the leaking taps in the country that we want to close. That's on leaking taps, talk of stigma index, and stigma and discrimination. We're talking about access to treatment and even getting financing. That's the other, because
aspect.
Global financing is reducing, and there's need to actually boost local financing.
So what are we doing about boosting and not depending on?
Exactly. About the response is about 80% donor dependent, which is not good enough. Although over the years, the country has actually increased from, let's say, they started with about 10%, we now have about 25% government intervention, HIV/AIDS. But still, we want to get the government in and also private sectors. So the present is to launch what we call the HIV Trust Fund in January. By that, we want to bring all we now know the importance and the great role private partners actually play in public health, and boosting the system, strengthening the health system in the country. So we want to engage private sectors to actually get them on board.
All right. How is the COVID-19 pandemic hindering the fight against AIDS?
Yes, COVID-19 pandemic actually disrupted so many systems, not only health alone, but initially when the months of February, March, April, May, we had some serious disruptions. One, we couldn't access, this lockdown, we could access treatment and everything. So we also deploy some of our workers to NCDC to actually help in strengthening the workforce of NCDC. Even some laboratories also, which were not really used for HIV/AIDS, we also converted for COVID. So we actually destroyed it, but we came out with some very strategic initiatives actually to boost our response. One which is more multi-month dispensing. So they, instead of giving 1 month, to give plenty, we give us 6 or 7 months to those who receiving drugs, so that you don't have access to clinic, you don't contact clinics frequently. And again, we also use support groups.
Yeah.
Support groups took these drugs to the communities to where these HIV patients live. So by that, we have to put close to 400,000 people on treatment within this period of COVID-19. Yeah. That's a great feat.
Yeah.
And Nigeria became one of the first countries, or even the best country in this regard. And other countries actually come to learn from this initiative.
Really?
Yes, and so we came up with some ideas, bright and smart ideas that to actually make sure that we came out of this major issue.
Right.
And yeah.
We hope that we end inequalities and end AIDS through sustainable financing. Dr. Ashefor Gregory, Director and Head of Department of Research, Monitoring and Evaluation at the National Agency for the Control of AIDS. Thank you so much for being on the program.